What if your smartphone could literally save your life by preventing a heart attack before it happens? This isn't science fiction anymore. It's happening right now in hospitals across America, and the results are nothing short of extraordinary. A groundbreaking artificial intelligence system developed by researchers at Cedars-Sinai has achieved something that seemed impossible just a few years ago, reducing heart failure hospitalizations by a staggering 74%. But here's where it gets controversial. This AI is now making medication decisions that doctors are following 9 out of 10 times. Are we witnessing the future of medicine, or should we be concerned about machines taking over healthcare decisions? The revolutionary study, which appeared in the prestigious journal JACC Heart Failure, followed 50 individuals diagnosed with a particularly serious form of heart disease, known as heart failure with reduced ejection fraction. To put this in simple terms, imagine your heart as a pump. In these patients, the heart's main pumping chamber, called the left ventricle, has become so weakened that it struggles to push blood effectively throughout the entire body. It's like trying to water your garden with a broken sprinkler system. Here's how this medical breakthrough actually worked in practice. For a full 3 months, each patient used nothing more than a standard smartphone application to send their daily blood pressure measurements directly to their heart specialists. Think about that for a moment. Your phone, the same device you use to check social media, became a lifeline connecting you to cutting-edge medical care. But this is the part most people miss. The real magic happened behind the scenes. The blood pressure data wasn't just reviewed by human doctors. Instead, it was instantly analyzed by a sophisticated AI program called HFAI, which stands for Heart Failure Artificial Intelligence. This digital assistant was trained using real patient data from Cedars-Sinai spanning from 2020 to 2022. And it incorporates both national and international guidelines for treating heart failure. The AI system then did something remarkable. It generated specific, personalized treatment recommendations for each patient's cardiologist. Should a new medication be added? Does a current dosage need adjustment? The AI provided clear, actionable advice based on the latest medical evidence and the patient's unique situation. Now here's where the story gets really interesting, and perhaps a bit unsettling for some. The cardiologists accepted the AI's medication and dosage recommendations an astounding 90.8% of the time. This means that in 9 out of 10 cases, experienced heart doctors were essentially following the advice of a computer program. As a result, these physicians more than doubled their use of evidence-based heart failure treatments that medical guidelines recommend. The results speak for themselves, and they're honestly jaw-dropping. In the 6 months before joining this AI-assisted program, 23 of the 50 patients had been hospitalized. That's nearly half of all participants. But in the 6 months after implementing this technology-driven approach, only 6 patients required hospitalization. That's a 74% reduction in one of the most feared outcomes for heart failure patients. Dr. Raj Khandwala, the study's lead author and co-inventor of this system, serves as Division Chief of Cardiology at Cedars-Sinai Medical Group and directs digital therapeutics at the Smith Heart Institute. He explains the significance this way. People with heart failure represent some of our most vulnerable patients, facing extremely high risks of both hospitalization and death. By converting home blood pressure data into actionable treatment guidance, HFAI enables us to optimize medications much sooner and successfully keep more patients out of the hospital. The research team is now planning to expand this program to include more Cedars-Sinai patients, which raises fascinating questions about the future of healthcare delivery. Are we approaching an era where AI assistants become standard members of every medical team? But let's address the elephant in the room. Should we feel comfortable with artificial intelligence making recommendations about our most critical health decisions? On one hand, this technology demonstrated remarkable success in keeping patients healthier and out of the hospital. On the other hand, some might argue that medicine is too personal, too human to be left to algorithms, no matter how sophisticated they may be. What do you think? Are you excited about the prospect of AI helping to manage your healthcare? Or does the idea of machines influencing your treatment decisions make you uncomfortable? Is this the natural evolution of medicine, or are we moving too fast toward an automated future? The conversation about AI in healthcare has only just begun, and your perspective matters.